Hello, everyone. I'm Dr. Shireen, and welcome back to our initiative, What After Dentistry. As you all know, we are a team of dentists with healthcare management background, and we are here to guide you and make you aware of the various career options in dentistry and healthcare. Today, we have with us Dr. Karnav Patel, who is an oral and maxillofacial surgeon turned into an entrepreneur. He is keen to bridge the gaps in the contemporary healthcare system. He completed his BDS from the Coorg Institute of Dental Sciences, and then he completed his master's in OMFS from AECS Maruti College of Dental Sciences and Research Center. Thereafter, he worked as an OMFS consultant at various hospitals in Ahmedabad for almost 3 years, where he was an integral part of the head and neck oncology team. With his desire to do something for the general population, he left his job and started with his first startup company by the name of Hashi Care in 2018, which aims to provide quality healthcare for all by connecting the best healthcare providers on a single platform by utilizing modern technology. Then again in 2020, he started another startup company by the name of Salvo India, which is into manufacturing medical consumables. Both the startup companies are recognized by the Department of Promotion of Industry and Internal Trade, Government of India. And even though he has not done any formal course in business studies or entrepreneurship, I'm sure that with his wide experience as an entrepreneur for over last 3 years, you would be inspired by his journey to become one. Let's hear what he has to say. We welcome you, Dr. Karnav, on our platform, and we are glad to have you. And we are really excited to have an amazing session with you on the scope and opportunities as an entrepreneur after BDS or MDS. Welcome you once again.
Thank you so much, ma'am, for your kind words and the introduction.
So, before we start into the formal discussion on how to become an entrepreneur, we would like to know more about you. We would like to learn more about your journey. How has it been so far?
I wanted to be a maxillofacial surgeon, so I gave my entrance exams. I gave the Karnataka CET as well as COMED. I had got good scores in both. Then I opted for OMFS at Maruti. Post completion, I came back to Gujarat. I started my practice. I was doing consultation, freelancing, and then I got a job at Shalby Hospitals. It is one of the premier hospitals. It's a group of hospitals in Western India. And I've been pursuing in head and neck oncology. I've been learning a lot, but there was a key intention from the first day of my job during my interview. To be very frank, I had no intention per se that I would be pursuing jobs, but I had one particular intention that I want to learn. So that was very predetermined. So even when I had been asked to visit the HR team or the interviewers, the first thing I told was that I might not stay here for long because I have come here to learn. And these are very frank. I was very clear about it from day one that I have come here to learn and I will leave as soon as I feel that I have learned something. So in the background, somewhere in the subconscious mind, things were there that I had to do business. I didn't know the word entrepreneurship earlier in childhood, but as a Gujarati, it was there that I have to do business someday. So that keeps growing and it develops over a period of time. When we are doing surgeries, we are doing a lot of advanced head and neck surgeries, the team, and I was learning a lot of things. So it gives me a very different perspective because I've learned a lot in the dental background also, from the maxillofacial also, and in general oncology also, along with head and neck oncology. So I didn't try to restrict myself to dentistry, and with the clear path that I want to learn more about the healthcare sector so that I get a better idea of how things work in multi-speciality hospitals. So I went on learning. I used to attend other surgeries also, which were not relevant to us, just to go and have an idea what do they use, what are the consumables, how are the practices, how could their lives be made easier. And those running around does help. And after 1.5 years, I thought that I might have to leave my job because I was slowly getting into the comfort zone of getting paid. So luckily I had good pay scale, and I was getting addicted to the salary. And I realized that at that point, if I don't leave my job, I might never be able to. So it was a harsh decision. I had suffered a lot because I didn't have any backup. But yes, I think that somebody at some point of time has to take a decision. It is one of the key aspects you need to do as an entrepreneur. And it's a process. I always believe that being an entrepreneur is like going to gym. Once you go to the gym, you don't expect to have a good physique on day one. It's a process. You keep going to the gym, you keep exercising, and one day, maybe after 2-3 years, you start feeling the difference or seeing the results. So don't expect results on day one, and you need to be as punctual as you are in the gym. It can be that you go for 2 months and you stop doing it. No, it's not. So this was in brief like how the journey went from my studies till today. Today, I am founder of two companies. One is Hashi Care Healthcare Private Limited. Another is IT Enterprises Private Limited, which runs under the brand Salvo. By God's grace, both are recognized by Startup India initiative supported by the government. We have one office in Ahmedabad for Hashi Care, one office in Noida, which has been given by the government for Salvo. So yes, there has been quite a growth story.
I think that's amazing, and as you said, it is very important to come out of that comfort zone if you really want to do something good and something, which is not in that regular journey that we generally see. So that's an amazing point that you have put forward. So we just want to know more about your ventures. How did you came up with this idea of Hashi Care and Salvo India?
Ma'am, the first thing, things happen by experiences. Entrepreneurial journey generally are based on experiences. So where you find gaps or where you find any pain points or problems. So one thing which I realized during my head and neck oncology, when we discharge our patients, so a lot of patients required post-operative care at home because for rice tube feeding, for IV infusions, and a lot of different things. Because after having mandibulectomy or maxillectomy, patients, when they are discharged, because we don't want them to have nosocomial infections or long bills by staying in hospitals. We want them to go to their homes and have better treatment at home itself. So they don't need to bear unnecessary expenses and they are not exposed to nosocomial infections. So there, I felt there was need for home healthcare systems, digitalization of home healthcare, and there were certain gaps which I felt were missing. So I started working on those things. So that was the basis. And personally, my grandmother had a fracture. And at that point of time, I used to take care of her. And from personal experiences, you build a lot of things that when I suffer a lot, see, as doctors, it's easier for us to have access to nurses and all. But for general public, it is not that easy to get nurses. And there are categories of nurses and categories like classification of doctors. Patients don't understand what is a nurse or what is ANM, GNM, BSc nurse or ICU nurse or what are doctors. For them, every doctor is a doctor. So even in dentistry, very hardly people know that there are 9 branches in dentistry. Or you can classify doctors into more than 100 classifications now, if I'm not wrong. So for general public to understand medicine has become difficult. Even doctors, like, let me tell you, a normal dental graduate might not know that we are eligible enough to do free flap surgeries. Like dental graduates who have done dentistry are doing free flap surgeries, like free fibula or radial forearm flaps, and doing much better than any other plastic surgeons or microvascular surgeons. So there is unawareness even amongst our own fraternity. The medical colleagues might not be much aware about what our dental colleagues are or what other parts of the fraternity are doing. So these problems exist, and we need to do something about this. And that's the reason I came up with this idea that I can help out in some way.
Right, exactly. As you put it very correctly, because post-operative care is something that is still missing in a lot of, in various parts of India right now. Also, though we have a lot of organizations now coming up with home healthcare system, but we still are not at par. So very correctly said, and that's very, very niche healthcare gap that you have covered with your organization as Hashi Care. So we want to know that did your dental or healthcare knowledge that you gained over a period of like BDS, MDS, and you work for 3 years. So over a period of, I think, 10 to 11 years. Did that help you in laying down your, or laying down the business skills that are required? If yes, then how did that help?
Yes, definitely it did, ma'am. Because in case if I did not study dentistry or maxillofacial surgery, I would not know the demands or the needs of the people. Right now, as far as the customer base is concerned, even doctors might be considered as our clients, and even general public can be considered as our clients, as far as both the companies are concerned. But first thing is to understand the needs of the medical professionals as well as the needs of the general public. And somebody should be there to understand the problems from both the sides. Only then we can bridge the gap. If you don't know the problems, there is no way you can bridge the gap. Exactly. So I had felt the problem as a doctor also, and I have faced the problems as a relative of a patient also. So once you realize that there are problems, you have to take the first step. The first step is to take the action. See, you will find every third person or every person, they will have some sort of idea, but nothing happens with ideas. Everything happens with the word execution. If you take the step, it is going to happen. If you plan, just plan, it's not going to happen. Or if you think it's not going to happen, if you start even a small step, it's going to take miles away. So plan it and take action. It's going to work.
Yeah, right. Exactly. Very well said.
So dentistry has helped. Over that, maxillofacial surgery. So in dentistry, we are not much exposed to the OT environments. So you don't understand what are the needs in the OT, what consumables are used in the OT, what are the problems people face in the OT, what nurses are facing, or what attenders are facing. So because of maxillofacial surgery, I got to enter OT. Then working in oncology, earlier for maxillofacial surgery, we just used to operate face. When I entered oncology, we used to operate different areas. So then I got to know more that what more could be done. So this is the exposure in my medical learning. Whatever I had learned, it's helping me out. That's all. Yes. So learning is a very important part of the entire phase.
Yeah, right. Exactly. I think every journey, everything that we do, somewhere or the other, it really helps us to learn something new. And then you need to come up with, or you either apply that learning or somewhere or the other. I think down the career path, it definitely helps one, whatever they have learned in their journey. So that's very well said. So, please enlighten our audience in terms of what are the steps required if one wants to start their entrepreneur journey in healthcare.
Ma'am, I have been an ardent fan of Napoleon Hill. He's author of one of the best books, Think and Grow Rich. Yeah. So I used to go to OPDs to 2 different states from Gujarat. I used to go to Rajasthan on first Saturdays and to Indore on third Saturdays for head and neck oncology OPDs. Yeah. So during my journey en route in trains, I luckily bought that book and I was reading. And I consider Napoleon Hill as a person who changed my life. Many people think that because his books are great. Yes. And that book has changed lives of million people. Okay, so the key word which Napoleon Hill uses is desire. So the first step to any entrepreneurial journey is the desire to bring a change. If you don't have a desire to do something, it is not going to happen. Then come to basic requirements of entrepreneurship or basic skill qualities that are required. It's not necessary that, a lot of people say that you are born businessman or this sort of thing. And as I said, it's like going to gym. Anyone can practice and anyone can become an entrepreneur. It's not a big deal. Yes, it is difficult. So first thing comes is courage, unwavering courage. Risk taking. You need to have that factor of risk taking. Like I left my job. I had a great job. Many people, they used to call me crazy. Many of my friends used to laugh that you're doing stupid things, you don't know. Many people I know in my early days, people might be thinking, the people used to say that practice might not be working, so he's doing that. No, unfortunately, I had a great job. I had broken a contract. I had worked free for 3 months. I had a 3-year contract. I had worked for 3 months to waive off my contract, just to make sure that I'm doing business in future. So I have sacrificed enough. I have paid the price. And one of my teachers once said, in my journey, there was an incident. I wanted to pursue my MBA in entrepreneurship. The reason why I was not able to do is my finances. I didn't have that much money. So I practically didn't have. I was debt ridden when I came out of college. So I had no scope of doing that. And coming to those risk taking abilities, I left my job. Many people don't want to do that. Okay, so once it is decided that risk taking should be there. Other thing is self control, which I believe you need to control your emotions. You need to have patience. You need to wait. It's not going to happen in a day. There is no magic wand. Uh, Another key aspect is the having empathy over your team or sympathy and understanding about your team. See, team building is one of the key aspects in entrepreneurial journey. You cannot build an empire alone.
Yes.
Any organization, it may be of 5 members, 10 members. See, our company has grown from a home-based company today. Like just 2 days back, we completed 1 year of our organization, Salvo. It started as a home-based organization. I started alone. I had 2 neighbors helping me. Today, our organization has over 45 people in our team. So understanding each one's, because you need to listen to them. Each one will have their own problems to understand their problems and to work accordingly. And team building is an important aspect. Other aspect is decision making. Decision making, just like doing surgeries or doing RCT, whether to do an RCT or not to do an RCT, or whether to do this surgery or not to do this surgery, or whether to go for this product or not to go for this product. Decision making is a key aspect. One of my teachers in maxillofacial surgery taught me decision making during midnight for a road accident case. And he taught me that Karnav, one of the key aspects is to make decision. You might be right, you might be wrong, but if you don't take a decision, it is going to make it much worse. See, no decisions are going to be correct always. You can either be right or not. But if you are neutral, it is going to harm you. So take decisions. Another thing is that sometimes you need to work without being paid for. A lot of people don't want to do that. In my case, I have gone to a lot of surgeries where I was not paid. I knew that it is free, but that learning experience, like I used to go for orthopedic surgeries. I know that I'm not going to be paid for, but I got to learn what orthopedicians do, what problems they are facing. I go to gynec surgeries. Now there is no role. I don't even assist there. But if I just stay in the OT, I take the permission. It helps me in some or the other way to realize from the business aspect also and from the knowledge aspect also what they do, what are the technicalities involved, what are the intricacies, what problems they face, and how can I as a businessman solve their problems. Other is definiteness of plan. See, planning, we lack planning. I can totally correlate in my own career. I have 2 startups. The number of mistakes what I did in my first startup were very high compared to what I did in my second startup. We don't plan it. If anyone wants to begin their entrepreneurial journey, I would recommend them to make written plans. Don't just think. Whatever you think, write it down, because ideas come and they go wane off. If it is written, it leads to how to make that plan in a definite manner. And there are people who can help you out. So these are some basic traits what you need as an entrepreneur, starting with desire to definiteness of purpose and taking the risk-taking capabilities.
Right. Exactly. So these are all the essential skills that you would need if you want to start your journey as an entrepreneur. And very rightly, he's pointed out all these things. So make sure that you work on these skills. Nobody is born with these skills. You will have to develop and acquire and learn about these skills. So thank you for putting it, so very nicely, and just giving the pointers that are actually required for the audience that they should know. So please tell us, what are the challenges that you see, these are faced in the healthcare industry right now, where, you see that keeping the Indian healthcare system in mind and the population that we have, the kind of population we have. So what do you think are the challenges in our healthcare industry right now?
So as far as the markets are concerned, yes, healthcare in terms of growth, yes, it is booming. But at the same time, the context what we are taking in, Indian healthcare market is a cost sensitive market. And we have different aspects like of healthcare professionals, different markets, private markets, government sectors and all. So it's a variety of market. You can sell the cheapest products and the quality most products in the same country. I think this is the only country in the world which has got such variety of such variety in a particular single market. So I don't think that there can be any better market to grow. One key challenge, or I'd rather see certain opportunity, what we see is that the imports, we as medical fraternity are mainly dependent on imports. 86% of products what we use, as most of the viewers are from the dental fraternity, let's take our air rotor or let's take our endomotor or micromotor. Anything you use is not from India. It's either made in China or made in Korea or made in Japan or made in Israel or made in US. We don't make. See, there are more than 3 lakh dentists using these products, but still none of the Indian companies are making it. Now, this itself is a big opportunity. Every person living in India is going to require dentistry. They will require dental treatment at some point of time in life. With improving quality of life, dentistry is going to improve. The standards of dentistry are going to improve. And I think people have become much aware post-COVID. People were not much aware about infections earlier. Even laymen are knowing much about infections, I think. Now, I think after the advent of the WhatsApp University, they give doctors' advices rather. So these definitely will bring a lot of changes in the attitude of patients also. They will be much more aware about the hygiene levels. And this will give rise to new markets. And it will definitely give rise to new entrepreneurs from the doctor fraternity too. Yeah. So cost sensitization is a challenge. Understanding of the market is a challenge. And we are not a quality driven market. Okay. Most of the people that are asking is what is the cheapest? There are very few doctors where you come across that which is the best product. Yes, it's not that. As I mentioned earlier, you get a variety of consumers asking for cheapest product as well as the best product. So everything is possible, but the focus should be key in manufacturing.
Yeah, right.
And that is what even the government is focusing on. We should reduce our imports and be a self-dependent country.
Yeah, right. Exactly. The Make in India, initiative that is being led by the government, I think that's something that one should definitely work towards it and make sure that we have less of imports, like you are saying, and we work and we manufacture things in our own country rather than buying it from other countries. That's well.
So the practical aspects can be seen in latest example. We can see gloves.
Yes.
Okay, you will see. I have come across a lot of friends saying. I read a lot on social media that people are overcharging on gloves. This, that, a lot of things. A lot of doctors don't know how the manufacturing of gloves occur. It's definitely they might not be knowing, and I would like to bring it to the light that unfortunately we as a country are to be blamed, not anyone. We as a country, we are to be blamed, even the government included. See, we should have taken steps. A country of 135 crores not manufacturing gloves is a criminal offense in itself. This is an unpardonable mistake what we have done as a country. We should depend on certain things. This is Malaysia. Majority of the gloves come from Malaysia, and many companies are controlled by China. We cannot expect things to come at a lower rate when the global demand is so high. And these are some of the reasons why we as a company do not supply gloves also, because sometimes people perceive that we are black marketing. So with no intention to black market, I do not want to get into such things. But as an entrepreneur, I know where, because I'm actively involved in the import export also, I do understand that things are not that easy. And when the demand and supply, the gap is so high, such things are bound to happen. So we need to become self-reliant, and we as doctors need to step in. Manufacturing is practical or not possible because only doctors understand what they want. If I want to make an endomotor, an engineer cannot make it. A dentist has to be involved. An endodontist has to be involved. So we need to make an endomotor, and we have to. We need a biomedical engineer. We need an electrical engineer. We need an investor. We need a venture capitalist. We need government support. So as a team, we have to work and manufacture. Just by dreaming that India is going to be a great country, it's not going to happen. We need to get in, we need to come out of our comfort zones, we need to work very, very hard, and then things are going to change. And I want to add something to the last question. One key aspect about an entrepreneur I forgot to add: willingness to take responsibility. If anyone from my team makes a mistake, I should be held responsible. See, we have a habit that somebody else has done a mistake. Please don't do that. Whoever has done a mistake from your team, accept that it is your mistake, because it is under you whom the mistake has occurred.
Yes.
So this is a very key aspect. If you take responsibility, the team is going to be motivated. They will learn from the mistake. You teach them. It is the onus is on us to teach. I cannot expect that they are going to know automatically. If we don't teach them, the team is, even in dental practice, if we are not going to teach junior doctors how are they going to operate on complicated cases, it's not going to happen over a day. It's we who are going to train them to be better, and the results will show in future.
I think that's absolutely correct. One of the, what we have seen is the good organizations that we have globally also, you have to be people oriented company, and then only you can run a successful business. That's what, while we were pursuing MBA, we have been taught, and we have been saying this also, that it's very important to take care of your own people first, because that is what keeps them motivated. That is what keeps them, on their toes most of the times. So that is very, very well said, and absolutely correct in terms of like taking care and taking onus on yourself rather than blaming your team is something that one should definitely have that, skill as an entrepreneur. So, Dr. Karnav, would you like to recommend if somebody wants to, get into this journey of entrepreneurship, should they do a formal course like an MBA in entrepreneurship, or they should just start with their idea or whatever they want to do as an entrepreneur?
The answer is, it is personal choice. You can do an MBA or you cannot. You can pursue without an MBA. Business can be done by anyone, regardless of they are educated or uneducated. So let us keep in mind that for doing business, you don't need any degree. You only need to do it. You need to learn. Learning does not require a degree. There is one word which I use again and again, is execution. You might be PhD in something, but if you are not executing on what you have learned, it is not going to give the commercial gains, because commercializing any knowledge is the key to success. Because believe me, see it, you might like it or not like it. I have seen in practical world people measure success by money. As far as I was not earning, people used to laugh at me. Very, very, very frank answer. As far as becoming an entrepreneur is concerned, when I studied from Harvard. There are videos. See, knowledge is available for free. So if you have time, if you have a chance, join some good course. There are MBA courses in entrepreneurship. MBA, you can be an entrepreneur without MBA like me. I have learned from videos available from Harvard Innovation Labs, from Stanford. The videos are available. IIM Ahmedabad has a 20 video course. After registering in Startup India, the government of India provides you a lot of lectures taken by IIT professors. I have been attending a lot of workshops. See, this thing I would like to reiterate. Attend a lot of workshops. You need not do a 2-year course. Not everybody needs to do it. If you have a one particular idea and you want to pursue your idea, you can attend 3-day workshops or 1-week workshops, and these are going to help. You would have seen a lot of endo courses for 2-3 days or implant courses for 2-3 days. See, don't compare these things with that. I have my own perceptions for different things. But learning business is comparatively easier than learning surgery. Okay, surgery is something which is much tougher and it requires much more commitment. Learning business, yes, if you have certain tenets, you can do it. Yes, it is equally risky or even more riskier, but we cannot compare surgery or dentistry with business. Those are different aspects. Dentistry and surgery are much more difficult jobs. So you can learn. Knowledge is available on YouTube. Knowledge is available in a lot of courses. See, these days, digital courses are available on many platforms, an academy or Byju's, or you go to YouTube, you don't need to spend even a penny. Believe me, I haven't spent even a penny. I have bought some few books. I love reading. So I read I download PDFs from somewhere or friends. Yes, I don't have much time to speak. Otherwise, I can speak for days. Government support is available. You can get books from incubators and accelerators for free. So you don't need to spend money to learn. Government will spend all the money. You can learn. Only thing what you need to do is put in your efforts and convert your ideas into reality and help India and world a better place.
Exactly. So I think that's very well said. And you all can see, like, without any formal degree in business studies, or entrepreneurship. He's absolutely doing an amazing job. And you can, learning is something that is not restricted to the formal education that we generally abide by. There is so much material available on the net, and as he said, once you register your startup, the government themselves, they help you out. They provide you all the learning material that is required in the form of videos, in the form of books. So there is enough material available to you. It's just that one desire and that push which is required for you to start your entrepreneur journey. So if you're interested, you can always connect back to Dr. Karnav and have a one-on-one chat with him and get more insights into how to start this entrepreneurship journey. So
Ma'am, actually, I'm sorry, ma'am. Actually, I'm mentoring a lot of startups also. So if anyone, as you have conveyed, that if anyone wants, yes, I'm always available. I am mentoring startups for virtual reality in healthcare. One of my startups in Ahmedabad is working on virtual reality, and there are other startups also working on various products. So I'm helping a lot of people in the grooming startups, and I hope a lot of people will come up with new ideas from our fraternity and make dentistry more self-dependent from India itself.
Yes, right. Absolutely. That's the future of. So, you have already pointed out it before in your previous conversation. We just want to have more pointers on what are the areas which you think that dental fraternity can pitch in and solve very basic problems that we see in the dentistry.
Ma'am, dentistry is a very huge market across the world. Yeah, I have come across a lot of dentists who are in dilemma what to pursue, and as the program suggests, what after dentistry. So let me tell you that dentistry gives you exposure to almost everything in the 5 years of study. We are exposed to a lot of different arenas. So as far as entrepreneurship is concerned, you can build a business on any product. Let us take any department. For example, start with oral medicine and radiology. Oral medicine deals with product. Start with mouth mirror. We can manufacture mouth mirror. We can manufacture probe. Now, you might not be happy with the mouth mirror. Develop a better mouth mirror. You're not happy with the X-ray. Develop a better X-ray. You're not happy with the OPG. Make a team. Develop a better OPG. Coming to oral surgery, you're not happy with the forceps you use. You feel that a better retractor can be developed. Go meet somebody. Go meet an engineer. Take my help. Develop a better retractor. You are not happy with the stains in your oral pathology. Why don't you get into developing a better stain? You're not happy with your scaler in periodontics. Why don't you develop your own scaler? We are not happy with the rotary system. Your apex locator doesn't work well. Why don't we think that we have been using what is given to us? It is more like a rat race. Somebody told you that you have to use gypsum products in dental materials. You use gypsum product. We have another thought that why don't we use a new product? Why don't I develop a new product? Every department has an opportunity. Each and every department has an opportunity of entrepreneurship. So I would suggest a lot of people to get into manufacturing. India is not manufacturing enough.
Yes, absolutely.
With active involvement.
Yeah,
other point in dental fraternity, 3D printing. See, 3D printing is something which is going to change how we do rehabilitation, maxillectomy, mandibulectomy, or dental implants. UC mucormycosis is improving. With 3D reconstruction, maybe in future those patients can be rehabilitated. So 3D printing is a booming arena. Doctors should get involved in 3D printing because without their involvement, I know 3 companies where doctors are not involved and they are into 3D printing. Okay. There is a famous prosthodontist in Pune, Shivasta sir. I think they are into 3D printing, and many prosthodontists can get involved in 3D printing. They are huge. Srinivas sir, I'm sorry for the name. Srinivas sir is involved in, he has a company, he has a startup in Pune. They do phenomenal rehabilitation, and a lot of prosthodontists and surgeons should come up with new rehabilitation techniques. What we miss is good bone grafts. Our fraternity can work on. We can work with biomedical engineers and develop new grafts, maybe allografts or variety of grafts. Believe me, our doctors are not working. Whatever innovations are occurring are done by biomedical engineers. I recently was giving a talk at a biomedical engineering department at a university, and there we were discussing that doctors are not getting involved, and even they are not getting involved with doctors. The same thing is not happening in other countries. See, government is trying to create an ecosystem, but what is the use of ecosystem when there are no players to get involved? You can create a cricket ground, but if people don't come and play, what is the use of the ground? So government has given funds, government has created incubators, but there are no doctors who are founders. I am not boasting, but it's a fact. So I want to encourage, I kindly request all the viewers, please try to convert your ideas into reality. Uh, this country needs it.
Yes, absolutely. So as he has already pointed out, all the essential skills that are required, the desire to start doing something, and why we want more doctor entrepreneurs for our country basically. So he's done a very good job, and we hope that this session is going to inspire you, motivate you to do something in your, if you want to start your entrepreneur journey. And this, mind tell you, this is the future of Indian healthcare system, where we want more and more doctors to start. If they don't want to start as an alone or a solo entrepreneurs, at least start collaborating with organizations. We want more and more of doctor collaborations to happen, because these are the people who understand the healthcare industry much better than engineers or biomedical engineers who are doing it right now. So thank you very much, Dr. Karnav, for coming on our platform and encouraging the audience to do something in their entrepreneurship journey. Thank you so much for sharing such wonderful insights, which I think we really needed this kind of session, that how a doctor can become an entrepreneur, because this is something that you will rarely find. It's a very rare combination that we generally see right now. We don't know how the future is going to be. So thank you very much
Thanks a lot, ma'am.
for coming on our platform.
Thanks a lot, ma'am, for your kind words and appreciation. From my side, I'm doing a bit, whatever I can for the fraternity and for the improvement in quality and manufacturing in India. I am seriously very concerned about the manufacturing sector in India. It's something with employment creation is involved. So without employment creation, the country is going to suffer. And we actively need to get involved and solve our problems. See, we are facing problems and nobody is going to come and solve our problems. We need to do it ourselves.
Yes, absolutely. And we wish you all the best in your future, endeavors and your journey as an entrepreneur ahead. So for all the audience, if you have been listening to our session, thank you very much for patiently listening to us today. And we hope that this session has inspired you, motivated to do some change in the healthcare system. So thank you all for patiently listening. Please subscribe to our channel. So please support us. Please motivate us to do more such interactive sessions for you. And for that, please hit that subscribe button. Don't forget to like and share our video in your network. I will see you in the next video. Until then, bye and good luck.